This is the manubrium of the sternum and the body of the sternum fused together. Some of the models that we have the pieces in separate pieces, and some of the models have them fused like this. The third part of this sternum is the xiphoid process, spelled with an X like xylophone, and it is made of cartilage, so it's not present on any of the models that we have, but it's represented on all of the articulated models that show the sternum. So you could be asked to identify it on those models. On the manubrium, the indentation exactly in the center of the top of the manubrium is called the jugular notch. And then the indentation on either side of the jugular notch is called the clavicular notch, and it's where the sternal end of the clavicle articulates with the sternum. At the bottom of the manubrium, and then several running down the sides of the body, these smooth indentations are facets for costal cartilages, which is where the cartilage that runs between each rib and the sternum articulates with the sternum. So it's very important that these are not just called costal facets, because they are not articulating with the ribs, they're articulating with the cartilage that runs between them. And if we look at a rib, so I can ask you about the costal cartilages on any of the articulated thoracic cage models. The rib will have one bumpy end, and this one's actually broken. Yeah. I'll just trim this off. I should have actually looked at the rib. The whole head's broken off. All right, so this is the rib. And one end of the rib is pretty bumpy and has some interesting looking features, and then it kind of flattens out and goes to the other end without getting bumpy. So the bumpy end is the posterior end of the rib that's going to articulate with the thoracic spine. And the very end of the rib, the expanded end, is the head of the rib. And then where it narrows just beyond that is the neck, just like my head narrows down to my neck on the top of my body. And then it comes to a very rounded bump coming off of the bone, and that is the tubercle. You can also call this the rib tubercle or the costal tubercle. The rest of the shaft of the rib is called the body of the rib. And on the inside edge of the body, you'll find a groove. This is called the costal groove. Costal just means rib. And this costal groove needs to be at the inferior edge of the rib when you hold it up to your body or determine right from left. So I want to make the bumpy end at the back of the rib, make sure that the costal groove is running along the inferior inside edge of the rib. So this rib is a right rib.